Research shows that breastfeeding is the absolute best form of infant feeding for both mother and infant. However, in some situations, babies are unable to breastfeed or are unable to take complete feedings at breast. In 2022, the American Academy of Pediatrics revised their policy statement on breastfeeding based on overwhelming evidence in research and practice that supports the benefits of human milk feedings. In this document, the AAP recommends exclusive breastfeeding for approximately 6 months after birth. Furthermore, the AAP supports continued breastfeeding as long as mutually desired by mother and child for 2 years or beyond. In some situations, direct breastfeeding is not always possible, and a specialty feeding device might be needed. There are a number of factors that can lead to challenges with positioning, creating a seal around the nipple, weak sucker vacuum, or endurance at the breast, and can impact milk supply. These factors might be related to the baby or the parent. In this presentation, we'll discuss 3 types of specialty feeding products. They include the Medela soft feeder, special needs feeder, and supplemental nursing system, or S&S. Before we discuss each product in detail, there are a few points worth mentioning that are relevant to all of these products. First, specialty feeding devices should be used in consultation with a lactation consultant or an infant feeding specialist with ongoing supervision as long as the product is in use. Second, discuss with the infant's physician or practitioner the desired volumes for infant feedings. When supplementing feedings at breast, use test weights to determine milk intake from breastfeeding, and then add these volumes to what infant takes by the specialty feeding device. Third, develop a plan with the infant's parents to monitor infant weight gain if the infant is at home. Finally, as with all Medela feeding and pumping products, all parts that come in contact with milk are not made with natural rubber latex, BPA, or DEHP. The soft feeder is a great ally for moms experiencing breastfeeding difficulties. The soft feeder's specially designed soft silicone cup offers more feeding control than traditional cup feeders. In addition, the soft feeder allows the baby to be fed until they can transition to breast without developing a preference for feeding with artificial nipples. With the soft feeder, you're able to control an exact amount of milk in the lip of the cup, preventing flooding or overwhelming the infant with too much milk. An infant using the soft feeder laps milk from the lip of the cup and extends their tongue over the lower gum line. This method of feeding requires little energy and rewards even the slightest feeding efforts. To assemble the soft feeder, press the white membrane into the raised side of the yellow disc so that the stud goes completely through the center hole. Fill the container with the desired amount of milk. Slip the silicone reservoir into the collar. Put the membrane disc assembly into the teat. Make sure that the white membrane and high rim of the disc are facing the inside of the teat. Place the reservoir assembly over the bottle and screw all the parts together using the collar. Next, hold the feeder upright and remove some air from the reservoir by squeezing below the pads. Keep squeezing and tip the feeder upside down. When you release the pads, breast milk will enter the reservoir. Repeat the filling steps until the reservoir is almost filled. As the baby is fed, the reservoir will automatically refill. When the reservoir is full, the pad will hold 2 milliliters of milk with another 11 milliliters of milk below the pad. To feed the baby, hold the feeder horizontally with a slight angle upward on the bottom of the bottle, like you're holding a pencil. Angle the feeder so that the air that remains rises to the end of the bottle. Angling the bottle in this manner is essential to the automatic refill feature of the reservoir. Begin the flow of breast milk by gently squeezing the 2 pads on either side of the reservoir. This will pool the breast milk in the feeding tip of the reservoir. Use the tip of the reservoir to tickle the baby's mouth open. Lay the rim of the reservoir on the baby's lower lip. Tip the feeder so that the breast milk pooling in the reservoir is fed to the baby, or allow the baby to lap up breast milk with their tongue. After each feeding, Take the feeder apart, making sure that the valve is separated from the disc. Rinse with cold water to remove as much breast milk residue as possible. Wash all parts in lukewarm, soapy water. Rinse thoroughly with cold water. Do not turn the reservoir inside out or push anything through the slit in the reservoir. The feeder should be sanitized by boiling for 10 minutes. The special needs feeder and the mini special needs feeder are designed for babies with conditions that hamper their ability to maintain adequate suction for feeding, including feeding difficulties due to facial or oral problems. The specially designed silicone feeder teat adjusts milk flow to suit the baby's needs. A slit valve in the teat controls milk flow by opening only when the baby sucks and closing between sucks. This allows the infant to control the feeding and not be overwhelmed. The special needs feeder works well for an infant who has a weak suck or is having difficulty feeding. The teat is separated from the container by a one-way valve. Once filled, milk is held in the teat and cannot flow back into the container. All of the baby's sucking efforts are directed onto the contents of the teat, so even the weakest suck gets results. The special needs feeders also have an air inlet groove which allows air in at the same rate as the feeding is released. There is no vacuum to work against the baby's sucking efforts, and air swallowing is avoided. There are two versions of the special needs feeder. The special needs feeder is available with either an 80 milliliter or 150 milliliter container. For preterm or small babies, the mini special needs feeder features a smaller teat that holds less milk. It includes an 80 milliliter container. To assemble the special needs feeder, press the white membrane onto the raised side of the yellow disc so that the stud goes completely through the center hole. Fill the container with the desired amount of breast milk. Slip the silicone teat into the yellow collar. Put the membrane disc assembly into the teat. Make sure that the white membrane and high rim of the disc are facing the inside of the teat. Place the teat assembly over the container and screw all parts together using the collar. Next, fill the teat by holding the feeder upright and squeezing some air out of the teat. Keep squeezing and tip the feeder upside down. Then release and some milk will enter the teat. Repeat these steps several times until the teat is almost full. As the infant feeds, the teat will now automatically refill. The slit valve in the teat on the special needs feeder controls the flow of milk from minimum to maximum flow. To change the milk flow, the feeder position is simply changed by rotating the slit until the optimal valve position is achieved. When minimum flow is desired, the slit should be horizontal in the baby's mouth. By rotating the slit to the diagonal position, milk flow is increased. To feed the baby, select the desired flow rate and turn the feeder so that the corresponding line on the teat points towards the baby's nose. Adjust positioning of the feeder according to the baby's responses and needs. Raised markings on the reservoir of the teat indicate the position of the slit valve in the baby's mouth. The longer the mark, the greater the flow. If the baby needs additional help, the reservoir of the teat can be gently squeezed and released to deliver a controlled amount of feed to the baby. Take the feeder apart, making sure that the valve is separated from the disc. Rinse with cold water to remove as much breast milk residue as possible. In a dedicated wash basin, wash all parts in lukewarm, soapy water. Rinse thoroughly with cold water. Do not turn the reservoir inside out or push anything through the slit in the reservoir. All disassembled parts of the feeder should be sanitized by boiling for 20 minutes. The Supplemental Nursing System, or S&S, is a nursing device specifically designed to help mothers and parents to breastfeed or chest feed by supplying additional milk to the baby while they are being fed at the breast or chest. The S&S facilitates bonding and skin-to-skin contact, promotes milk supply by stimulating the breast through sustained sucking. Supports non-lactating adoptive, surrogate, same-sex, transgender, and non-binary parents to create a breastfeeding, chest-feeding experience. Supports babies' oral development of sucking skills to create vacuum, and provides milk supplementation without the use of bottles and teats. Medela offers 2 types of SNS: a disposable starter system designed for 24-hour use when short-term help is needed. The second type can be used for long-term supplemental feedings at breast or chest. Common to both systems is that they use gravity to promote the flow of milk from the container to the baby. Raising either SNS will increase milk flow, and lowering it will decrease milk flow. To assemble the starter SNS, place elastic ring with a quick clip around the bottom of the container. Use a Medela 80 ml or 35 ml container, or another container with the lip at the bottom of it. Fill the container with the desired amount of milk. Press the white membrane into the raised side of the yellow disc so that the stud goes completely through the center hole. Push the bulb of the teat through the collar. Put the membrane disc assembly into the teat. Make sure that the white membrane and the high rim of the disc are facing the inside of the teat. Screw the teat assembly onto the container. To prime the system, hold the unit in the upright position, and while gently squeezing the bulb of the teat, invert it so that the tubing is facing downward. Gently squeeze the bulb part of the teat again to fill the tubing to prevent the baby from swallowing air. Clamp off the tubing using the on-off clamp to avoid milk flow. Clip the container to the shoulder area of the gown or nursing bra, with the bottom of the teat being level with the parent's nipple. Place tubing on the top of the nipple, making sure it extends about 1/4 inch beyond the nipple. Secure it vertically with a piece of tape extending down to the base of the areola. Avoid applying tape directly to the nipple. Another piece of tape may be placed horizontally at the base of the areola if needed. Next, position the parent and baby so they're comfortable, then help the baby to latch. Release the tubing from on-off to release the flow of milk. Milk flow can be adjusted at this point by lowering or raising the starter SNS. You may also prime the system by gently squeezing on the bulb part of the teat. The starter SNS is sterile and does not require cleaning before first use. Fill the container full of warm, soapy water and clean the teat assembly by squeezing the bulb. Refill with clean water and rinse the teat assembly by squeezing the bulb. Squeeze the empty bulb a few times to remove water droplets from the tube. Completely disassemble and clean the container, disc, membrane, and collar with soapy water. Rinse well and dry on a clean towel. To assemble the SNS, fill the container with the desired amount of milk. Attach the clip to the ring. Place the assembled ring and clip around the base of the container. Place the valve on the end of the twist lock lid. Screw the assembled twist lock lid onto the container. Thread the twist lock tube through the clamp and press the tube into the clamp so that the milk cannot flow. Screw the assembled tube and clamp onto the twist lock lid. There are 2 options for using the SNS. With either option, clip the SNS securely and comfortably to the bra strap, top, or pillow. Option A is to position the tube, position the parent and the baby so that they're comfortable, then help the baby to latch. Once the baby has a good latch, gently insert the tube about 1/2 inch to 3/4 inch into the top corner of the baby's mouth. Release the clamp to let the milk flow. Option B is to use fixation tape to help position the tube. First, tape the end of the tube to the breast with it protruding past the nipple by about 1/4 inch at either the 10 o'clock or 2 o'clock position. Then position parent and baby so they're comfortable. Then help baby to latch. Release the clamp to let the milk flow. Before first use and after each use, rinse all parts with cold water. Clean all parts with plenty of warm, soapy water. Rinse all parts again with cold water. Fill the cleaning aid with warm, soapy water and flush the tube 3 times. Flush the tube again 3 times with clean water. Finally, flush the tube with air until the inside is visibly dry. Further, clean the container, twist lock lid, valve, and lid with either boiling water, in the dishwasher, or with Medela Quick Clean bags. To clean with boiling water, cover the container, twist lock lid, valve and lid with water and boil for 5 minutes. To clean in the dishwasher, place the container, twist lock lid, valve and lid on the top rack or in the cutlery section. To clean the container, twist lock lid, valve and lid in the microwave. Use the Medela Quick Clean bags in accordance with the instructions on the bag. After cleaning, leave to dry on a clean cloth. In this presentation, we discussed 3 Medela specialty feeding products designed for parents and infants with unique feeding needs. Each of these products supports the delivery of human milk until babies are able to fully breastfeed.